Aching muscles or joint pain, how do I treat them? Well, there's a couple ways, and today's video is a 2-minute health hack from RX Healthy Habits on heat wraps versus oral anti-inflammatories. I'm going to go this pretty quick because in my description there's some links where you can read more about this. But let's go through and talk about what types of pain should you seek to treat with heat wraps or oral anti-inflammatories. For heat wraps, you're thinking about muscle aches and stiffness, arthritis pain, and there are some heat wraps they use for also menstrual cramps. All right, so that's the types of pain. Now, oral anti-inflammatories, Ibuprofen, Naproxen, those are best for headaches, acute injuries, sprains and strains, and inflammatory conditions, tendonitis. They also can be used for menstrual cramps. So I'm going to go through though and talk about the advantages, heat wraps and oral anti-inflammatories, and the disadvantages. Advantages of heat wraps: targeted relief, no systemic side effects. They work just right at the area where you put them on. A neck pain or shoulder pain, you can put them right there, right? So they can be worn for extended periods of time, sometimes 8 to 12 hours. What are some of the advantages of oral anti-inflammatories? Well, they're quick relief. You take them and usually within 30-40 minutes you're feeling it. They reduce inflammation and fever, and they're versatile for various types of pain, a little bit more broad, right? What are some of the disadvantages of heat wraps? Well, they're not suitable for most acute injuries. They have a potential for skin irritation. They have a limited duration effect where if you take a pill, it covers you all night. What are some of the disadvantages of oral anti-inflammatories? Well, potential stomach upset, very rare but very serious GI bleeds, and not recommended for people on blood thinners. So oral anti-inflammatories like Naproxen, Ibuprofen, not good if you're on blood thinners. So in summary, if you really have a pain that's persistent and severe, you really need to see a healthcare provider. I can't say that enough. So I think sometimes people seek treatment and there's something serious going on, but if it's a mild to moderate and short duration, maybe this is your answer. So one last thing. Next topic on the next video is going to be tinnitus, ear ringing. Make sure you tune in. And we also hope you subscribe and share this 2-minute health hack.